Welcome back in, everybody. On Friday, St. Vincent Infirmary is so good to supply us with great doctors talking about some medical issues out there. And today, Dr. Gary Goza is here, the medical director of the St. Vincent Infirmary Sleep Center. Welcome to you, man.
Thank you.
Yeah.
Glad to be here.
How did you get involved in becoming a sleep specialist?
Well, I'm a neurologist by my original background, but through the years I've always found sleep problems to be fascinating and gradually included that to be a bigger part of my practice. And so for the last few years I've had a practice that's just limited to treating people with sleep problems.
Exclusive to that. Are sleep problems more prevalent than they used to be?
Well, there's a lot more recognition about sleep problems, but some conditions like sleep apnea, which is the main thing that sleep centers deal with, has always been around, but the awareness of it's such that an astounding number of people seem to be turning up with it.
People can get help though now.
Yes, there are some very effective treatments for sleep apnea. Usually it involves sleeping with a CPAP machine, but there are some other options as well for people who are not happy with that.
Why would a person maybe get to the point where they think, I need a sleep study? And what goes on when you get there?
Well, the most common situation is someone who's a loud snorer, and of course their sleep is affected, not only them, but the person that's in the room with them. But the person with sleep apnea usually wakes up in the morning not feeling refreshed. They make it through the day, but they're tired and they get drowsy. Eventually, you reach a point where you know that that's just not normal. And when you come through for a sleep evaluation, it involves coming into a sleep lab like we have at St. Vincent's, which is similar to sleeping in a motel, only you've got wires attached to you. A technician is in the room next door monitoring various things that we record, like your breathing and your brain waves. Yeah. And from that, it allows us to just accurately determine if someone has sleep apnea or other problems as well.
I've heard a lot of people say in sleep studies it's a great night's sleep because you've got the instrumentation there, and you make it a great environment for the folks that come in.
Well, we try to make it as much like home as possible. Yeah. There obviously it's a special situation, and we sometimes give people a little sleeping medicine if they need it to sleep through the study. Yeah. But it's ordinarily it's a painless type of test and provides us with very valuable information.
Is snoring just kind of an annoyance, or is it a sign that maybe something is really wrong?
Well, many people snore occasionally, and we don't really regard snoring itself as such a big problem. If someone's a very loud snorer, though, there's a good chance that they have sleep apnea, which, besides causing the symptoms I mentioned, can also increase your risk for other health problems, particularly heart attacks and strokes. And so we've become much more interested in finding people that have apnea and trying to treat them early so that we can prevent those kind of problems.
Apnea, tell folks what that is. That's just, you just kind of quit breathing for a period of time.
Well, I think of apnea as an extreme case of snoring. With snoring, what's happening when you're asleep is that your airway is narrowing and you're having to suck air through to get enough air to breathe, and all the tissues vibrate as you do that. Sleep apnea is such that your airway relaxes so much that it actually closes off or almost closes off to the point where your oxygen level drops.
Oh, that can't be healthy.
No, and some people will have hundreds of times a night where they stop breathing momentarily. They don't know they're doing that unless someone's around to really observe it. They just know that when they get up in the morning, they feel at least as bad as when they went to bed.
Wow. What about if people are just having trouble maybe falling to sleep at night?
Well, most people are going to have occasions where they can't go to sleep easily under periods of stress or various things. Some simple things to sort of avoid are caffeine, which tends to fight your own body's natural ability to get to sleep. Alcohol is often used by people to help them sleep, but it's not a good choice because even though it gets you to sleep easier, you tend to wake up more the last part of the night. It's important to try to get a regular sleep schedule, but about 10% of American adults have trouble sleeping most nights, and for them, it can be a very life-altering problem, and that's a lot of the kind of patients that we see in sleep medicine, people who really need help either with medication or with some lifestyle changes to try to sleep better.
And quickly, how much sleep do we need a night?
Well, everyone has their best amount. Most people need between 7 and 8 hours. Yeah. Most people in the United States don't get that much, which has become kind of a national problem. And one I think we need to try to get people educated about more.
Well, that's yeah. I need more sleep. I know that.
I do
Probably
too.
everybody does too. Right. Hey, if you'd like to get in touch with Dr. Goza, you can find him out at his practice, which is the Sleep Clinic of Arkansas. It's on Canis Road, Suite 700, and there's the address on the screen. The phone number there, 501-312-0070. Again, the medical director of the St. Vincent Infirmary Sleep Center. Hey, very informative.
Thank you.
And great to see you.
Glad to be here.